Hello and welcome to Health with Patricia, with me, Patricia Rockson Hammond, where we have honest conversations about issues affecting your health and well-being. Today we are discussing recurring vaginal infections such as the yeast infection, the BV, and then the Trich. And today, it's time with your gynae here on Health with Patricia, and we're speaking to Dr. Promise Sefogah. He's a consultant obstetrician gynecologist here at Shape Healthcare Specialist and Medical Center. He is also a senior lecturer at the University of Ghana Medical School. Hi, I'm glad to have you once again on Health with Patricia.
Absolutely.
Thank you for this honor.
Yeah, it's a pleasure to be here again.
Recurring vaginal infections. I know there's yeast infections, there's the BV, and then there's Trich. What's the difference? So like maybe a first timer will understand, because maybe to them, every infection is candida.
Right.
So help us understand.
So absolutely, not every infection is candida. So once you mention candida, candida is a type of yeast which normally resides in the vagina.
Okay.
Right? In the vagina, you have different groups of organisms. The yeast is one group. The commonest type is called a candida.
Okay.
Then we have other bacteria such as the lactobacillus, Gardnerella, a few others. And they all live in a way that they maintain the vagina to be acidic.
Okay, sure.
So in life, something is either acidic or alkaline. Okay. Now, the acidic nature is protective for the vagina to keep itself healthy. So the coexistence, if you have this portion of the yeast, this portion of lactobacillus, this portion of other bacteria, that is what maintains the acidic nature.
Okay, sure.
So if one thing happens that one group of these organisms begin to overgrow, then that becomes an infection.
Okay, sure.
Okay.
Sure.
So the yeast is the same as what we call a candida infection.
Okay.
Or vaginal candidiasis.
Sure.
It only means that the candida, which is a type of yeast, has overgrown to the extent that it is causing symptoms.
Okay, sure.
And the symptoms of the candida infection are a whitish discharge. Sometimes the discharge piles up and looks like yogurt or cheesy.
Okay.
Or they describe as cottage cheese, okay? And it goes with a lot of itching in the vagina or outside. And then sometimes, if the infection goes on for a long time, the color can change to off-white or sometimes yellowish.
Okay.
Sometimes it can start off as candida, which is the yeast, and then on top of it, you get a bacterial infection.
Okay,
then
sure.
Now it becomes offensive, bad smelling.
So on a normal day, the normal yeast doesn't smell. It's just the discharges and then the itchiness.
In the normal circumstances, the normal vaginal discharge that a woman has, one, it's not too plenty to make you uncomfortable or to wet your underpants.
Okay, sure.
It does not have any color. It is clear, or at worst, just cloudy. It doesn't have any smell.
Okay.
And it does not cause any irritation or itching. So these are the features of a normal vaginal discharge. Anything outside this means it is abnormal, right? So when it is itching, most likely is the candida or the yeast infection, right?
Okay, sure.
Good. Now, the bacterial vaginosis is commonly caused by an overgrowth of another type of organism we call the Gardnerella. You don't need to remember that.
Oh, sure.
That is a bacteria. So again, it multiplies in excess under certain conditions, such as when anything happens to reduce the acid nature of the vagina, then it grows. And then when it grows, it makes you have plenty more discharge, which may be yellowish.
Yeah.
Now, it tends to have a fishy smell, right? It does not come about through a sexual affair. It's not sexually transmitted, really.
Okay.
But it increases the risk of you getting other sexually transmitted infections.
Okay.
Because then the vagina gets a bit inflamed when you have the bacterial vaginosis. Then we have to, so when you have a discharge, you are not able to tell what type of discharge it is, which is why it's always important that you report it. We will check to see what type of discharge it is. figure out exact diagnosis and treat it.
Not self-medicate.
Not self-medication, because then you are not sure what you're dealing with. The third type is the Trichomoniasis vaginalis.
Yeah.
That is sexually transmitted. Again, the discharge is a little yellowish. Sometimes you may have a tinge of green. Then it may be itchy, and it also has a bad smell.
Okay.
That is sexually transmitted. Sometimes the vagina gets inflamed, and in white people, it looks a bit reddish.
Okay.
Okay. And that, if not treated promptly, can lead to infertility.
That's serious.
Right. So when a vaginal discharge is abnormal, it could be due to bacterial vaginosis, it could be due to candida, it could be due to other types which are sexually transmitted, such as the Trichomoniasis vaginalis. Some vaginal discharge actually also happens as a result of cervical cancer.
Oh, okay.
Cervical cancer also produces some discharge which is offensive, extremely offensive. Sometimes a pelvic infection can also lead to an infection. And all these, if you sit on it, you're not sure what is going on. And then the worst happens, where you have very bad complications that become now difficult to deal with, or life-threatening complications. Say, for instance, if it's due to cervical cancer, cancer spread over time, and then we are in trouble. Okay.
That's serious.
Yeah, so if it is due to candida, then we're likely to give you advice regarding how to manage personal hygiene as well as some lifestyle changes. For instance, we say minimize your intake of sugary stuff.
Okay.
Right. Because each time your blood sugar, you consume sugary stuff, your blood sugar goes up.
Yeah.
And that affects the acid level in the vagina.
Okay.
Then simple infections like the candida, the body cannot control it. It weakens your body's immunity. Other times, when somebody has excessive bleeding,
Okay.
the blood is alkaline, so it neutralizes or reduces the acid nature in the vagina. Then these things
More
will flare up.
bacterials.
Okay. And so we will advise you on what to do. Things such as when you wash your underpants, you make sure you dry it under the sun. Or if you don't have access to the sun where you are, you make sure you iron it. That kills all the spores in the pants. So you don't treat yourself and wear those pants again and reinfect yourself.
Okay, sure.
Then if it is a bacterial vaginosis, same hygiene advice in addition to some antibiotics.
Okay.
Occasionally, we may advise some form of vaginal wash based on the circumstances.
Okay.
Again, if it is a trichomonas, there is a specific type of bacteria, antibiotics we give to take care of it. Some will just be oral. Some will be oral plus something that you have to insert. But the most important thing is that when you have vaginal discharge, which is abnormal, you should report it, because it could lead to a bad pelvic infection, which could damage your tubes and make future pregnancy difficult. Again, it could be due to a cancerous cause that you don't know.
I think later on in this conversation, we'll be discussing cervical cancer, and then we'll explore that further. But I want to ask, why do women treat and still have it coming back?
Yes, that's when it becomes recurrent.
Yeah.
It only means that it has not been cleared completely, or you keep doing something repeatedly wrong,
Which is still
bringing
increasing
it back.
the bacterials in the
Yes,
vagina area.
Exactly. Or like I said, if you keep consuming a lot of sweets,
Okay.
or those who do douching is not healthy because it kills the good bacteria, which maintains the acid, and then the bad bacteria will multiply.
It is. I've also heard some sayings that I stand to be corrected though. There are some vaginal wash, like feminine wash, that also increases the risk of getting these infections.
That is true. So when we recommend the washes, then we are going to recommend something that has a tendency to increase the acid level.
Okay.
They are the ones that may be helpful. Apart from that, the washes go to kill the bacteria and make the place less acidic. Then other organisms would overgrow, and then you haven't made progress.
Looking at the ones that affect fertility, is it just the Trich that affects the fertility, or there are others like the yeast?
So no, yeast will not affect
Doesn't affect fertility.
No.
BV doesn't affect fertility.
But they can, over a long time, can get superimposed with other bad bacteria, which can then go up. You see, when there's infection in the vagina here, what we fear is that the bacteria infection would climb up. This is the cervix. It goes up, then it gets into the womb, and it gets into the tube. That is when there is trouble.
Okay, sure.
Okay, so any bacterial infection that we don't treat properly here, that's the extent to which it can go. Which is why any bacterial infection, we take it very seriously, particularly in women who are of reproductive age. I mean, so long as the problem is there, you need to get help, particularly if it is repeated, then you need to see a specialist gynecologist. Then we're able to go further and see, okay, maybe this particular medication you're taking is not working, so let's switch to something higher. Or in addition to the oral one, let's switch to something which is also you insert, we call the pessary. Or then we bring the lifestyle counseling. Sometimes though, repeated candida infections could just be a sign that this patient's blood sugars are high.
Okay,
Then
sure.
we want to check, okay, do you have a family history of diabetes? And then they say yes. Okay, let's check your blood sugar. There you go, she's diabetic. And that is the only thing that has pointed us to be able to diagnose her diabetes. And so it's not enough to say I've been treated and it's still coming back and I'm tired, I won't go again. No, seek for help, but then maybe at a higher level.
Okay, sure. At what point should women stop self-medicating? Because if I come, for instance, you treat me and then maybe you give me ABC antibiotic. The next time I go home and I see the same symptoms, in my mind, I was given ABC antibiotics. So I am tempted, or let's say I'll just go back to the pharmacy and then go get that particular thing.
Yes.
And so instead of coming to the hospital to get checked again, maybe to seek further advice, I'll just go back.
Yeah.
So at what point should we...
It's tricky. So long as this problem has come, seek help. Because you may be thinking it's the same thing, but the truth is it may not be. It is better you go and the specialist checks you and they say, oh, it's the same thing. Let's take the same medicine. Even that, sometimes if it's the same thing, the same medicine, we may change the dose or add on to it or change the medication entirely. So there's every good reason to seek help.
So at what point does the partner come in?
Anytime you're having these repeated infections, it's best to present together.
Okay.
There may be something for both of you. Because sometimes you get treated, your infection is cleared, but because you have sexual intimacy, he is also carrying some. So you are treated, he got it from you when you were infected. You are treated, you are clear. He comes back to meet you and then you take it back and you keep sharing. So occasionally it gets to a point we have to treat both of you to eliminate the infection.
Okay, sure.
Yeah.
I believe...
But if it is an infection which is the Trichomoniasis, the sexually transmitted one, every time we have to treat both of you. Even when we detect it the first time. It doesn't have to be repeated before.
But why is it that the men do not show they don't show any sign? This is always the women. Why?
Because the women are special.
No, but still.
So what it is even when you came and we detect that this is what it is, we'll give you the prescription and say, let your partner also take this.
Without him having to come in for checkup and all that.
If he's not available at that consult, you will take the prescription to him that this is for both of us. If there's difficulty, then if the situation permits, then you can call and then have a discussion with the nurse or the caregiver for further explanation.
Okay, sure. Thank you very much, Dr. Sefogah. Please, what's your final advice to the audience?
Vaginal infections, one, they are common. They could just be something in the vagina. They could also be a sign of something more serious. If it's becoming repeated, do not keep going back and taking the same medications. The fear is you could be dealing with something cancerous. There could be some serious underlying condition, or sometimes occasionally even fibroids can cause some type of discharge. And so it's not in your place to be able to know which one you're dealing with. So that is why we say do not just self-medicate. Look for help early so that the problem can be solved earlier to prevent future complications such as infertility and a worsening cancer.
Thank you very much, Dr. Sefogah, and that's my gynae, Dr. Promise Sefogah. He's a consultant obstetrician gynecologist at Shape Healthcare Specialist Medical Center here at Latibiokoshi. So any issue, any gynecological issue you have, I promise you, and I bet you, he is the best. So please locate Shape Healthcare and come and see Dr. Promise Sefogah. He and his team are always on standby to help you. Until same time, next week, stay blessed.